About a 70-year-old woman came to me complaining of pain on the left quadrant. We didn't know exactly what it was. You know, obviously we have this tooth that was treated a long time ago with a post and some recurrent decay around the crown. So we decided to treat this one first. We also knew that she had a probing depth on tooth number 14 on the palatal, but we didn't know whether that was a fracture. It couldn't be visualized intraorally or microscopically at the beginning. So our case started with the retreatment of tooth number 13. We went ahead and did that, filled the case up to where it was supposed to be, large diameter instrumentation with antibiotics and so forth. And then we started to address number 14. And that's really where I want to bring your attention to. Number 14 seems like it was done well. The palatal seems a bit underfilled or non-filled, we don't know. But after looking into it a little further, we went ahead and medicated the case. And we found out that the palatal did, in fact, after medication, depict a fracture, a vertical fracture. And this is the palatal root right here. And you can see a little bit of a line showing that there is bone loss over there at that angle. We decided that we were going to, at that point, schedule her for implant. Again, a 70-year-old woman. She didn't want to really go into implant. It's a long-term process, 6 to 8 months maybe, and after bone augmentation and so forth, and she wanted something immediate. I think the phrase that she used is, you know, at my age I could be dead, you know, in a year or two, and what am I going to do with an implant at that point? So we went ahead and offered her something that was offered a little while ago before implants came along, which was root resection. So we retreated the case. You can see this was before and this is after, and they're much thicker and more pronounced filling points. And then this is actually, I cheated and I went ahead. This is actually after resection of the palatal root. So we have the palatal root here. It extends all the way up here. That's direct post-op. And this is after the surgery for removing the palatal root. Now, how did we arrive at diagnosing and treatment planning removal of the palatal root? Well, it was patient concern, but also, again, I used three-dimensional imaging to create a great deal of patient acceptance so she could be confident that we could do this for her, and why the palatal root at this point could not benefit her any further, either lose the root or go ahead and extract the tooth and place an implant. And this is the case. Again, I'd like to start off with the three-dimensional, and you could see all three roots, distal, the mesial, and the palatal, right there in that image. And again, I want to bring the point that this is a focal CT, which gives me exactly what I need. 3 teeth, maybe 4. And I don't irradiate the patient more than I need to. So you'll see right here that this is, in fact, the palatal root, the fracture, although that may not be able to be as clearly seen, the fracture. But what we see, which is very unique here, is that the sinus, we can see these bony projections as if the sinus was either expanded or broken. And this was prior to us even treatment planning for root resection. We wanted to do an implant, and we wanted to know how much bone we had to deal with and whether we could do an implant and what our measurements were. But it gave me an incredible view into her particular case and what were the limitations. For example, in this case, I would have, removing that root, had I not known this, if I pressed apically, I may have pushed the root into the sinus. Things of that nature. In our two-dimensional image, this was not apparent whatsoever. I mean, you did not see that. But in our three-dimensional data set, we can see that this is uncanny, and really it's a wonderful tool to have to understand the case better.